Hey guys, it's Amanda. I am here with Dr. Molly.
Hi.
Of Back and Balance in Dunedin. This is the Pretty House Powwow. I'm not being as excited as normal because this is a doctor's office. And you can't get crazy, but we're gonna go behind the scenes. I'm gonna ask all the questions that you have always wanted to ask a chiropractor because I have no filter, which is helpful. So Molly's gonna give us a quick tour. She's gonna show us all the rooms and all the stuff. And then we're gonna do some funky treatment on me that's gonna make me taller, thinner, and smarter, right?
Exactly.
Okay, so let's go, Dr. Molly. Show me around.
All right, come with me. So I'm going to take you back into just a couple of our treatment rooms here. So first and foremost, I'll start you off in our decompression room. If you ever hear of patients that have pain going down into their arms, coming from their neck, this machine right over here, maybe if you want to, perfect. That will lift up the cervical spine off the nerve to help give that nerve that break from being compressed. And it will help that pain centralize and then diminish altogether.
Okay, so does your head go here?
Yep, your head goes right in through here. And then the machine itself pulls up this way at a weight tolerable to you. So it's not uncomfortable at all. It actually feels wonderful.
So it's not like one of those things you see where you
It's not a
flip up.
torture device.
Yes, yes. Okay.
Not at
Good,
all.
I appreciate that. What is this thingy over here? This situation?
This over here is, it basically moves. It helps with people with balance issues.
Oh.
And stimulate that neuromuscular education in there. So it moves up and
nice.
down like this and helps people kind of maintain their balance and strength altogether.
Oh, very cool.
In this room too, we do a little bit of therapeutic exercise to strengthen the muscular after patients are, out of pain altogether.
Oh, okay. Like what would be one exercise that you would maybe do?
So I do a lot of, if patients come in with low back pain.
Ooh, me, yes.
I'm gonna have to drop down. So
Okay, let's drop it like it's hot. We're dropping it like it's hot.
And do what's called a bird dog.
Oh, yeah.
Strengthening the musculature in the low back.
And you work that core.
And it allows you to work the core as well.
I think the male viewers really appreciated that.
Yeah,
What was that called? Bird dog?
Bird dog.
Okay, yeah. My yoga studio does that. So that's for the lower back?
And for the core, yes.
Okay. What's your second favorite lower back? I'm just going to get a free
You're going to get a free workout.
Free workout while I'm in here. Is there a second lower back exercise that you recommend people do?
So this one's even more friendly. So you
great.
also lay back.
Oh, now we're going
here.
to put your legs up. Are you
And
gonna...
it's basically just a glute bridge.
Oh, my husband loves these. Yeah, the old glute bridge.
So you tighten up the glutes, and that also strengthens the core and the low back as well.
Oh, all right.
Yeah.
I saw on YouTube a bodybuilder put a weight on her like pelvic area.
Yeah, you can do that, especially if you're completely out of pain. That's a good exercise to do for more advanced. But for most patients, they just do the
Don't do the
glute
weight
bridge.
first is what she's saying.
Yeah, do not do at home.
Right. Come see Dr. Molly anyway before you do any of these things because, especially if you have lower back pain, one false move and you're like out for the count.
You are. So then I'll actually take you into one of the adjusting rooms here. We do all of our therapies in the rooms itself. So this is one of our adjusting tables.
Okay.
The table goes down like this to give the patient a little traction in that lumbar spine. And then up as well to kind of open up that disc space.
Oh.
We do all of our therapies in the room. So any muscle stim, it helps the muscles contract, decreases any inflammation in there. And then ultrasound as well. Not like the pregnancy ultrasound that you see at a gynecologist's office, but the ultrasound to help decrease muscle spasms wherever the patient may have it.
Oh. I did not even know that that was a thing.
Yep, it is. And then we also do light force adjusting with the activator. This is extremely light force. Basically, if you want to put it on your hand, that's about as intense as it gets.
Huh.
We have a little more.
So where do you just do that on people's like parts?
Mid-back, neck.
God, I think I need an appointment.
So we do that for mainly like osteoporotic women who the crack that you normally hear through chiropractic, they don't tolerate that well. So that's a little bit lighter force for those type of patients.
Oh, nice. Okay,
This is a little bit higher up on the scale. This is called the arthrostim. For patients that don't really like the crack of adjusting, this helps them to have that segment move. And then we also do hands-on adjusting, which is the patients that get a little more motion we utilize our hands.
What does the crack mean? What does the crack tell us?
Yeah, so what that is essentially basically just air being released from your joints. So when you pop your neck and you're like, oh, I heard that, That's just nitrogen being released from the joint space.
And that's normal.
That's absolutely normal. What we
Okay.
don't want you to do is go like this and crack your neck.
Oh, yeah.
Because that's just not healthy for anyone.
Right. Your neck probably shouldn't go that way.
Yes.
Okay. Awesome. Show
And then
us some
I'll
more.
take you down this hallway here
Hi, Tara.
into our acupuncture room. So currently Dr. Ross is the one certified in acupuncture. It's very zen in here.
It is.
Our patients love it. But in the next couple weeks, I'll be certified in acupuncture as well. I'm finishing my course.
Really?
Yes. I'm very excited.
Oh, that's exciting.
Yes. So I have to take the boards first. So I am board certified once I complete that segment.
Oh, wow. Okay. I didn't know you had to get board certified to do acupuncture.
Yep.
See, so many things to learn.
Now back into here is our retro kitchen. This is kind of where we hang out and have lunch. Wakes us up if you aren't awake.
I mean,
right
that
now.
orange is special. Oh, and there's games and puzzles.
We do. We specialize in puzzles in the front because it gives patients something to do while they wait. But we don't.
But
like
there's
them
not
to
a long
wait.
wait time.
Yeah, yeah. We don't want them. To
If you can finish a 1,000-piece puzzle, you're at the wrong place.
You are. This is our X-ray suite. So we have
Oh.
digital X-ray. So we'll take a picture of somebody's low back, neck, mid back, whatever region they're feeling pain, and we get to see it right away over here on this screen.
Oh, okay.
So it pops up immediately. So we'll be able to review
everything
it with
is
them.
in-house?
Yep.
Seems like.
Yeah.
Okay, that's kind of nice.
Yep. And then that's pretty much it. And I'll take you into my office and we can sit down and chat.
Okay. And there's the nasty scale. No one likes that.
So this is my office here, my little cove that Dr. Ross's wife designed for me.
Oh, how nice.
Yes.
Okay, so let's just try to guess who Dr. Molly loves more, her dog or her boyfriend. So I'll show you the pictures. Yeah. But wait, there's more.
I think still it takes precedence.
This is the desk.
And
We're
he
gonna
gets
go-
a little corner right
Oh,
here.
he is. He made
made
the
a little
corner.
spot.
There he is. That's cute. All right, so Dr. Molly's going to do something to me. So I'm going to extend this out a little further so we can see what's happening. So what am I doing?
So I'm going to do a class 4 laser treatment on you. What that entails is basically it's a cold laser, although you'll feel a little bit of heat coming from it.
Okay.
It decreases inflammation in there. It allows the promotion of healing damaged tissue.
Okay.
So I'm going to utilize a setting as some plantar fasciitis on the bottom of her
I'm getting
foot.
very nervous.
Don't get nervous. It'll feel wonderful.
Okay.
It'll feel like a light massage with a little bit of heat to it.
Okay.
So what it does is it kind of, like I said, decreases inflammation and promotes that healing process, especially on a region that is constantly being used, like the bottom of your foot or your
Right.
heel.
Right.
We utilize the class 4 laser on shoulders, elbows, knees, low back, different areas that have that inflammation, and we can set it accordingly.
Does class 4 mean something?
Class 4 is the highest level of cold laser.
Oh.
It's right under a surgical laser. So surgical lasers cut. This does not cut. Don't
Okay.
worry. We're not cutting anything today.
And is this the same laser that does laser hair removal?
No, it's not.
Oh, that's disappointing. Could have done 2 birds with 1 stone.
That would be wonderful if we did that.
Wouldn't that be great? I could be beardless when we leave. Not that I have a beard. Okay, so how do I do this? What do I do?
Yeah, so you had some issues.
I
going
had
on in your
plantar
foot.
fasciitis for about a year, and so now everything makes me nervous.
Okay.
I just wear like low heels and.
So what I'll have you do is I'll just have you have a seat right in this chair.
All right,
here.
having a seat in the chair.
And
You
then,
can tell I'm nervous because I'm getting fumbly. Okay,
And then just put your foot up here.
foot up.
Awesome.
The foot is up, ladies and gentlemen. We're doing a class 4.
I'm gonna make her
Laser.
wear these awesome glasses.
Oh my, thank you.
You look so
for
good
that.
in them.
Well,
So good.
So we're at Dr. Molly Laterna's office in Back in Balance in Dunedin, and there's also other doctors here, obviously. It's not just Dr. Molly. It's Dr. Ross and
Pat Snare.
And Pat Snare is actually the first, right?
She is, yes. So Dr. Pat Snare opened the office 35 years ago. Dr. Ross
What?
just bought her out 1 year ago today.
35 years ago. I had no idea. That's crazy. You weren't even born yet.
No, I wasn't.
Dang, and I just figured out that she's young. I didn't know how old Dr. Molly was.
I'll be 30 next week.
Oh, yay!
Yeah.
Where's the party, Dr. Molly?
I don't know yet. Somewhere though. You
She's
guys
just
are
not
all
telling us.
invited.
She's just not telling us. There's the party. I'll get to the bottom of it. Oh, Tara. Tara said Mrs. Hollywood. I think it's your glasses, not mine. Okay, so this is, does this normally take how many
It'll take
sessions?
about 3 to 4 minutes.
Okay, and that's
Yeah,
it?
And that's it. So I'm going to go in through here and,
Okay.
and put plantar fasciitis in as the setting.
Uh-huh.
And we'll start it up. You'll hear a couple beeps.
Okay.
So this is the head of the machine itself. Hold on one second here. It looks like a little massager.
Uh-huh.
And so I'm going to start it up. And now which foot is it, Amanda?
It's the left foot.
Okay.
Here we go.
So I'm just going to rub it on the region of the plantar fascia. Do you feel heat?
I do feel heat.
Good. Not too hot?
No.
Good.
Is it going to start soon?
Nope. This is the
Oh,
treatment
it's happening.
itself.
This is happening. So will I be healed after this?
You will probably notice, we like to say
I was
a
kidding.
couple of
There's no way
treatments,
one treatment should heal a
but
person.
yeah, a couple of treatments, but you might notice something different. Like, it didn't hurt when I got out of bed as much. My pain maybe was a 2 out of 10 opposed to the 6 out of 10 that you normally feel. Obviously, it does take several treatments to complete, but you should notice a little difference.
Do you up the heat the more you come, or do you just start at is it always the same?
It's always the same.
Oh.
Yep.
This actually feels really nice. They should somehow factor this into when you get a pedicure.
Yes, that would be great. One stop here. But
Right?
I'm not painting your toes. I'm not painting your toes.
So normally several sessions to...
Yeah, depending on the region. So if you have a sprain strain, a muscle, a ligament that's injured itself, that will take, 6 to 8 visits, we say. And then we'll do a reevaluation on you and see kind of where you are at, and we'll give you some exercises too to help strengthen that area. Plantar fasciitis is a little smaller of a region, so probably 4 to 6 visits itself. And then again, we'll give you some stuff to do at home to help strengthen that and to help heal it at home as well.
Okay. Can we talk about the questions that you don't want to probably have me ask you?
Sure.
All right. So, here comes the tough talk time. I am about to fall asleep, Tara. Hocus pocus. So when I was in high school, I saw a chiropractor and he made me very nervous, and I felt like he was a crazy person. So what kind of schooling do you guys have?
Sure. So I graduated from Loyola University Chicago with a bachelor's in biochemistry. I took a couple years off of school after that just to kind of figure out what I wanted to do, because I didn't know my whole life that I wanted to be a chiro. I knew I wanted to go in the medical field, but I just wasn't sure what. So I worked alongside a chiropractor. So you have to have experience in the chiropractic field before they accept you into school. And then when you get into chiropractic school, it's 3.5 years of schooling in addition to that 4-year bachelor's degree.
Can you go to chiropractic school without a bachelor's degree?
You cannot, no. You have to have a
Wow.
bachelor's. So technically it's 7.5 years of school.
Huh.
Yeah.
And are there chiropractic, did you just study chiropractic in that 3.5 year program?
You did, yeah. So you did the basic anatomy and physiology, different courses. So you learned how to adjust. You studied every system of the body, so ears, nose, throat, GI, all of that. Because essentially in Florida, we are considered primary care physicians. So if patients want to come here first, they can. Obviously, I recommend most patients have a primary care doctor in the event that they need
Florida,
an antibiotic.
you can do that.
You can do that.
You accept insurance?
We do. We accept United Healthcare, Medicare, Ambetter, and then we have also some cash plans for patients.
Okay. Huh.
Yes.
That's
How
exciting.
does it feel?
It feels good. It feels warm.
Good. Not too hot?
No.
Awesome.
I feel good. So, how do you know what... Because you don't just want people coming in here that you can't help. How do you know what a chiropractor can help with and can't help with? Because we went through so many things. Well, I can do this and I can help with that. But how do you really know? Is there a list?
So essentially what I like to do with patients, you want to keep those on?
I kind of do. Okay. Now I'm feeling very Kardashian. No. All right.
We're all done.
Okay. I feel great.
Good. So essentially what we like to do is we'll do a free consultation for patients. We'll have them come in, we'll discuss kind of what's going on for them, and then if we feel that we can actually help them, we'll set up an appointment to do so and to either take x-rays, unless they already have them, MRIs if they already have them, and then we'll provide them treatment. We like to do a trial of care, say, twice a week for 2 weeks, and then reevaluate them. If we are helping in that instance, then obviously continue with care. If they're seeing no change, then we refer them to the appropriate person that can help them.
How long of a period did you say?
I'm more of like a 2 to 3 week type of person. If I know that they're not getting better by, the second or third week, I'm not going to keep making them pay money to stick around, because obviously I'm doing a disservice to them.
Right.
It's more about getting the patient healthy, getting the patient better, and that's really what it is. And in addition to that, you establish connections with other physicians as well when they know that you're qualified to make the decision, that you're not just hoarding all the patients and not helping anyone.
Right. So what would you say if somebody's considering going to see a chiropractor? Are there any red flags when choosing your chiropractor? Like, what do you look for? Because I can tell people what to look for in a realtor, and I can tell people what to look for in a house cleaner. But what do you look for in a good chiropractor?
So you want somebody that's honest. There's a lot of chiros out there that are going to try to sell you massive, huge care plans that are worth thousands of dollars on your second visit. You do not want that, because you may get better in 6 visits. Yeah, it may take you 30 visits to get better for as long as your pain has been going on, but you don't want somebody that's going to make you pay thousands of dollars out of pocket when you don't really know if it's going to work. You want somebody to work with your schedule. You also want somebody that does a thorough examination on you. So when you come into the office, our first initial patient, we'll do a huge exam, head to toe on them, just to evaluate every region of pain. We ask you a series of questions too, to kind of dive down into why this pain is happening and why it keeps bothering you. So that is huge. Some chiros will say, okay, lay down on the table, and they just adjust without even knowing what's going on. So those are my 2 huge recommendations.
Okay. Biggest pet peeve with patients?
Oh.
I know. Like, if you could say one thing to them that they actually listened to.
Okay, so don't take this to offense anybody. Patients who see chiropractors usually wait until the last minute when they're in 10 out of 10 pain to come in to see us. And I mean, that's with everybody too. But you don't need to come in that day. If you've been having 10 out of 10 pain for 3 months, you could have come in the day before, or the day before,
you could come
or
the day after. Yeah.
Don't wait till it's almost
unbearable.
Yes, absolutely.
That makes perfect sense. So you come in, let's say me, because I have those herniated discs. So I come in and you look at my x-rays and you figure out a plan, and I do however many sessions, 15 sessions. And then am I cured?
No, not necessarily. So we like to explain it. It's like an oil change in your car. You got to come in at least once a month. Some people can push it to 6 weeks. Some people can push it to eight weeks. You'll know your body. And it's almost just like an oil change, a tune-up, to get your joints moving, to make sure that your muscles are strong enough to hold those adjustments. And then it's just once a month.
Okay. Any other tips for people?
I would say therapeutic exercise. So when we tell you to do exercise, and the exercises that we give to you, do them. They will help you tremendously at home.
I don't think anybody's doing those.
Yeah, most of my patients, I'll ask, I'll be like, did you do your exercises? And they're like, no. And I'm like, okay, no wonder you're not feeling much better. And they know it too. But so doing those exercises helps strengthen the region, help you hold your adjustments longer, and helps make you feel better overall.
Okay. And now I met a lady up at the front, and she does massage. So do you guys have massage here?
We do. We have 2 massage therapists in the office. They're both wonderful. They're here Monday through Thursday, and then Saturday too.
Oh, nice.
Yes.
Nice. Okay, and is it in that room, the acupuncture room?
No, they have 2 different massage rooms on the other side of the clinic that I didn't show you, just because there's patients all through the office.
That makes good sense. So if people wanted to come see you, is the best way to call? Should they make an appointment online? Does it matter who they see in the office?
Yeah, all of us practice very, very similarly. Dr. Russ is the male in the office, and then Dr. Pat and me are females. Dr. We're both females, so kind of whatever you prefer. The best way to schedule is to call the office. Bobby's our office manager. She's absolutely wonderful. She's been doing this for years, so she'll be able to help you kind of gear you in the right direction.
Okay, awesome. And then I think we are going to do a little giveaway. In the coming days, I'll create a little something, and we might maybe be giving away a massage.
We're giving away an hour massage in our clinic to those of you that are interested.
So yeah, there'll be a register to win. I will randomly draw the winner. No, it will not be rigged. Mom, do not register. You can't win. Neither can my husband or my child. Not that he would register, but I would, using him as an alias. Okay, so now we have the final questions.
Okay. I'm ready.
And you have to be truthful.
Okay.
If you could only eat one meal for the rest of your life, what would it be?
Sushi. Hands down. Sushi.
Oh, wow. Okay.
That was easy. That was an easy one.
Yeah, I was thinking you were going to go with Chicago pizza, but okay.
No,
I like
sushi.
sushi too. Okay. Good one. All right. The one pet peeve you wish you could let go of that you do. Like, what is the one thing you hate that you do?
Oh, man. Okay, that's a little more tough. Let me think.
She has no vices. This is a good sign. That means she'll never be too hungover to come into work. That means she probably doesn't have, like, smoky cigarette hands. These are good things.
Let me think.
I don't think she bites her nails. No. See? Totally not a gross chiropractor.
What is one thing that I don't like that I do?
If you're good, you can be good. I
I'm
think
good,
she's
I
good.
think.
That's
I
pretty
think so.
awesome. Well, she's 30.
I don't
There's still
exercise
time.
as much as I should. That's my...
She does Camp Gladiator. She's good. And what is your favorite cuss word, or do you not cuss?
I like shit.
Oh!
Because
that's a new
everybody's
one.
got it.
Do you have any opinions on gut health?
I do. Probiotics. Probiotics will be your best friend. I have Crohn's disease. If anyone has any questions about that, too.
Let's
in
talk
later
about that.
Episodes.
What is Crohn's disease?
So Crohn's disease is essentially an inflammatory effect in your gut that is basically autoimmune. So mine comes from genetics. Everyone in my family has it. My grandpa, my mom, my brother, we all have it. There's different foods that we have to stay away from due to the fact that it irritates our ball. Strawberries, no go. Popcorn, I haven't been to the movies in years because I can't have popcorn. I know, it's really sad.
Of course, you could just go and not eat the popcorn. I went to see
too
How to
hard.
Train Your
It's too
Dragon, and I
hard.
was just like, keep it away from me. Oh, strawberries. Okay.
Yeah, any red sauce. So my boyfriend's Italian, so it's tough for me to go out to dinner with him.
That's tough.
But anyways, so probiotics really help me to kind of settle down my bowel. Also, reduce stress. Make sure you do your yoga or some type of meditation throughout the day to reduce your stress, and that will.
Do you have a meditation that? Do you meditate?
I don't meditate. I do yoga, so that's
Okay.
my hour to myself and kind of getting rid of everything in my head for that hour.
Yeah, I started getting up a few minutes early the last 2 weeks, and I've started meditation, which is not my jam. Like, it's not my thing, but I needed to, like, find some center.
Yeah.
Gabrielle Bernstein, I don't know if you've heard of her.
No.
She's fantastic.
Really?
But she has a morning meditation that I did this morning. It's only 4 minutes long. I lasted for 3 of them. She's amazing. Her book is called The Universe Has Your Back. Highly recommend it. Anyway, just a side note, if
Sweet.
you're into meditate, it's hard, but she helps you get through it. Okay, so yoga and the Crohn's disease thing, probiotics. Do you have a certain probiotic that you use?
Currently I'm on Tara Esther's Plexus Ease. That's or the Probio 5. I've been using that, and it's been helping me tremendously. I've only been on it for about a month, but...
Okay. What did you call you said your ball earlier?
My ball.
You said strawberries are not good for the ball. Did you say?
Bowel.
Bowel. Oh, I was
Bowel.
like, what?
That's such
Where's
a
the
classy
ball?
word.
The bowel.
Yeah.
Okay, good to know. So that is your one opinion on gut health. Skin, because you have good skin. I've always wanted to ask you about it,
Skin.
and now you're on Facebook Live, so I want to know, what do you put on your face? Well, also keep in mind she's 30, so 30.
Honestly,
43.
I struggle with that, actually.
What?
I use the peach exfoliating scrub every morning and evening, and then I just use a lot of cover-up.
All right, guys, do you have any more questions, comments, or concerns for Dr. Molly? Back in Balance is on Alt 19, kind of just past Weaver Park, just south of Weaver Park on the left-hand side.
Yes.
Big blue sign. It's right behind BioBag, which I...
Yep, right across the street from Seven Sons Brewing for those beer drinkers out there.
Good call. You probably know Seven Sons over BioBag. What is BioBag?
It's essentially a huge worldwide company that produces
Those
environment-friendly bags.
Oh.
Yeah.
Who knew? I might stop in there and see if I can go to their factory or something. Okay, guys, so come on in, see Dr. Molly, get your plantar fasciitis fixed up with this laser, get your back in balance. Yeah. And you can do it all in-house, which is really nice. Thank you for giving me a tour.
Thank you so much.
You're very
Amanda.
welcome.
It's been fun.
Do you want to give out do you know the office's phone number?
I do. It's 727-733-6501.
Thanks so much, guys. Happy Tuesday. Stay dry. Bye.
Bye.